It's time to bring you your weekly capsule of health information. We call it your Healthy Dose. We're going to be talking about Ladies' Night Out.
We are talking about Ladies' Night, and it's coming up soon.
Julie Reed from the imaging department at Hannibal Regional Hospital is in the studio. Good to see you again.
Good to see you guys, too.
So let's talk about Ladies' Night Out. This is their night tonight. Everything's going to be all right. Like that song.
Right. It's time for us girls to have a little fun and take care of our breast health at the same time. We're going to have this Tuesday and Wednesday, May 14th and 15th from 4 to 8 o'clock. We have mini massages and relaxation techniques and gift bags and goodies to eat. And bring your neighbor and your cousin and friends and just have a girls' night.
And especially how appropriate following Mother's Day.
Yes,
that Sunday before.
That's why we came up with this idea a few years ago. Grab your mom, grab your sister, grab your cousin, and just take care of your breast health and have a good time.
So it's Tuesday, May 14th, Wednesday, May 15th, which is about a week and a half away. And you want to encourage everybody to have a mammogram to make sure it's taken care of. Now, you won't necessarily be doing mammograms that night.
We do mammograms that night. Yes. So you will come in, you'll have a 15-minute block, you'll make an appointment, and we'll do your mammogram, and then while you get to go, after your mammogram, you get to go have all the treats. We'll take your aunt or cousin or neighbor, whoever comes with you, and we'll have their mammogram. And this is designed for anyone over the age of 40 who has not had a mammogram in the last year. You just call and make the appointment, and we will have your designated slot, and we'll just have a nice evening enjoying our company.
Now, you say in the last year, do you suggest that people over 40, that women over 40 have a mammogram every year?
Yes, every woman should have a mammogram over the age of 40 once a year.
What is it, Julie? What's the appropriate age for that so-called baseline? Is it 40?
Baseline should be 40 for anyone. If you have a family history of breast cancer, close family, your physician may want you to have your first mammogram at 35 and have your baseline, and then not have another mammogram until 40. But that would be a physician discussion that you would have with your doctor.
And you block out 15 minutes of time for this to take place. Yep. I got to ask you, Julie, the earlier contraptions to do a mammogram must have been invented by a man who's never been through it.
Well, I think if you ask most women, they will say that the mammogram machine was invented by a man, period.
Okay.
But having said that, it's amazing the technology now. You know, we used to have films and processors, and you'd have to leave your patient in the room and while you went and checked everything with the physician, and it's just amazing. We do not leave the room at all. Everything is digital. Your previous films come up on the screen as well as your current study. You can compare everything right in the room, in and out 15 minutes.
That's amazing.
It is just amazing. And by the way, at Hannibal Regional, we use the Mammo Pad also on our tray, which is about 1/4 inch of foam. It's like foam carpet, and so it makes it very soft, so you're not against cold platform anymore. You're not getting dug in the arm from the corners, and it's just made the mammogram experience much better.
Well, it's like when you buy carpeting, they say the padding is everything.
Yes, and if you ask the majority of all the patients, they're like, how come we didn't have this 15 years ago? It's like, I don't know, but it's amazing how much it's changed the comfort of a mammogram.
Julie, it's because they push the men aside and let the woman take over.
And I'm not going to deny that either. So anyway, we have a special number. We probably ought to get that out there.
All right.
Our number is 573-406-1639. 573-406-1639. That is a direct call to make your appointment. So you won't have to have multiple phone calls. That is just the direct line for Ladies' Night Out.
Okay, and you just set up your appointment. You show up
Yes.
for your
Yes.
15-minute examination, and then you go on from
enjoy
there.
The pampering.
the pampering. That's right.
Now, when you talk about the previous images, if somebody has had previous images before with Hannibal Regional Hospital, they're going to be looked at that time too?
No, the radiologist will not be there that evening.
Okay.
They'll be looked at in the morning. But still, if they have previous films from another facility and would like to bring them with them also for comparison for the next morning, that would probably be an optimal solution too.
Okay, what's the cost?
I am not the cost person.
Okay.
But when they call to
They can get
make
the
their
details at
appointment,
that
they can get
time.
the details then.
Okay, very good.
I'm just the hostess.
Well, this seems like a really convenient way for women to come to get checked out and to do it in the evening.
This is why we do this, and we do this spring and fall. And we do this because we know that women have work and then supper and homework and school programs. So this is why we do this for 2 nights, so that they can take time out for themselves, because women notoriously put themselves last. You know, they're going to take care of their family and all their other obligations and then take care of themselves. So that's why we do this. And we've always had a really good turnout. It always goes over very well.
Well, there's a certain camaraderie when the girls get together.
Yes, especially when you can make it a fun environment, and we really, really have a good time.
Good to know. And again, this is by you can have fun, but you need to make an appointment.
Exactly. We can't make light of the fact that 1 in 7 women will receive breast cancer at some point in time in their life, and that is just a startling statistic. And early detection is always, always the key.
And it can be easily taken care of
Yes.
at that time.
Do you feel that breast cancer is on the rise in our area?
It seems to be very trendy for us. I just know from our facility, we'll go 3 or 4 months and we'll have really great screening mammograms and not a lot of diagnostic issues. And then it just recently, within the last 6 weeks, we've had 2 or 3 patients, young patients, that have had not such a great diagnostic outcome. And so it seems trendy, but it's still always about the early detection. And examples are, I hear, well, I just got so busy, the last couple of years taking care of this person or taking care of that, and I just didn't have time for myself. And now I've had this lump, and I've had this lump for, a couple months. And it's very disheartening for me to think, oh, if you just could have taken that 20 minutes, 15 minutes that we were offering you 2 years ago and come here, maybe the outcome would have been better.
Well, they still need to be reminded. They need to check for lumps
Yes,
at least
always your
every
breast
month.
exam with your physician every year, along with your mammogram. You have to have the dual combination.
Okay. Well, this gives everybody the opportunity to
Yes, it
come in
does.
and schedule that appointment. Come in the evening. Get this taken care of. It's very important.
Yep, and we really do have a good time. You really got to try us out. It's fun. It's really fun.
Will Robin be there?
Robin will be there.
Oh, okay. All right. So I need to call 573-406-1639 to make that appointment
Yep,
for Ladies'
that
Night
is
Out.
correct.
Hannibal Regional Hospital. And again, it's Tuesday and Wednesday, May 14th and May 15th from 4 until 8 p.m.
Yep, we look forward to seeing you.
All right.
All right, Julie.
Julie, thank you very much.
Thank you.
Thanks, you guys.
Julie Reed from the Imaging Department of Hannibal Regional Hospital, who, along with Hannibal Regional Medical Group, bring you Healthy Dose each and every single week at this time. You can get more information online anytime, hrhonline.org.